that, I know that there are a lot of people out in the zeitgeist who are pre-medical professionals as well, or they are in medical school right now, striving forward to become physicians. And with that, we have this series that is our 20 questions series. And so for people like myself who are both younger and older, we love to hear and learn from those physicians who have already been through the gamut, who have tussled and made their way to be direct clinicians and helping those people that we ourselves are hoping to one day help. So we have a set of standard questions we're going to go through. But first of all, we like to, the highlight of today is our intrepid interviewee, Joshua DeJong, MD, FAAP. And so that, for those of you who don't know, that means that he is a fellow of a specific American college of the specialty that he's in. But I'm not going to spoil anything. I'll let him talk about that. But first of all, for our first question, please tell us about yourself.
Hi, everyone. So my name is Dr. Joshua DeJong. So I am an Army pediatrician. I graduated from residency about 2 years ago. I'm a father of two, currently in Georgia. I did my undergraduate in biology and chemistry from Trinity Christian College just outside of Chicago, Illinois. And then I went to Medical College of Wisconsin. So I took 2 years in between undergraduate and medical school. Had a harder time getting in, but really found that I really enjoyed doing some research. So I did that in between undergrad. So I worked in a stem cell biology lab for a year, and then a pediatric cancer epigenetics lab for a year as well. And that's how I initially got interested in pediatrics. I actually had some really great mentors at that time that allowed me to shadow them on the peds hemonc floors. Actually going into medical school, I thought I was going to be a trauma surgeon. That's what I was really interested in at the time. I loved the adrenaline rush. Went to medical school. And as I was going to medical school, I was kind of thinking about, what do I want to do with my future? What does that kind of look like for me? My brother, he's a vet. So he was in the Army. 2010, he was deployed to Afghanistan in the kind of the Kabul area. And he talked a lot about the difference that having good doctors and having bad doctors had on him as a soldier. It's like, man, what an awesome opportunity to be an Army doc. So I actually applied for it and got what's called the HPSP, so the Health Professional Scholarship Program. So I applied for that as I was applying for medical school and got it off the bat. So the great thing with that is I had medical school completely paid for. So I never saw a bill. I never saw a loan from medical school. Army gave me a sign-on bonus. They gave me a monthly stipend for while I was there. And so while I was going through medical school in Medical College of Wisconsin, I really didn't do much of anything for the Army. There's a couple of basic trainings that I did to become an officer, did some active duty training, which was really just kind of doing like an interview rotation at a couple of different locations at a few of the pediatric residency programs in the military. So the ones in particular, I did one at Walter Reed, which everyone always knows as the President's Hospital. And then I also did another one at Madigan Army Medical Center out in Washington State. So after medical school, I did residency at Madigan. So that is a pediatric military residency program. So I did all my training in the Army. A lot of questions I usually get with that is, what does that actually look like? And it looks pretty much the exact same thing as a civilian residency. The training I got there, I will say, is second to none. Such passionate, pediatricians, subspecialists. We had the base, people get there, they'd come to the hospital and say, man, it looks like a small hospital. But I'll tell you, the walk that I had from our residency workroom to clinic, I passed by pretty much every subspecialty that you can name. So I'd walk past peds endo, peds palm, genetics, rheumatology, cardiology, developmentalists, all in the little walk from my workroom down to clinic. Such a tight-knit community of really amazing people. Ended up doing some rotations at civilian hospitals. And that was a really cool experience as well. So I felt like I got a really great overall great residency training there. Stayed on for additional year on staff as a chief resident. And now I have my first station position out here in Georgia. I split my time as a pediatric hospitalist, so covering down for the nursery, for the floor for any pediatric patients that are admitted, and then I also do some clinical time too.
Wow, that is absolutely amazing. A lot to unpack, a lot to dive in. I'm excited to be able to do that. So you mentioned that you wanted to become a physician and that you decided upon that. But when was the first time that you decided, hey, you know what? It's physician. That's just like, do you remember when I'm sure it might have been a gradual event, but like the epiphany moment?
Yeah, absolutely. And that's always the big thing. That's the thing that medical schools always want to know. Why meds, why medical, why medical? And for me, I always wanted to help people. I always loved the sciences. I always loved the critical thinking aspect of things. And was it physical therapy and whatnot. For me, I ended up doing a couple of medical missions trips that I remember going to Romania. And one of my mentors at the time, he was actually he was a geriatrician, and he worked with kids and families, and he really was just this amazing guy that kind of took me under his wings and was talking to me about his experience with taking care of people kind of at their worst, being able to step into people's lives, and to be a rock, to be kind of a voice of reason, but also just be able to help people out in an amazing way through science. And I thought that was just an amazing opportunity. So I saw him treat some pretty incredible things, some in some of the gypsy villages in Romania. And for me, that was like there's something special about this, being able to help someone out in this way. So that was kind of my initial, I think this is what I wanted to do. And I kind of mentioned the 2 years in between undergraduate and medical school. I did some research, and that was, I did research in undergrad and I really enjoyed that. But it was the shadowing work with some of the oncology doctors that also were doing research, and kind of following them from the lab into the clinic and seeing like it actually being played out with patients. So I started doing some shadowing. So yeah, it was kind of a general, move towards that. But for me, it was always, how am I going to try to help people out with, a special skill set? And I think that time in Romania is for me when it really kicked off.
Wow, that's amazing. And we see so many people who go out and they do medical missions, and yet at least from what I've heard, one of the complaints that some admissions committee members have is they go and they do these, but they don't have anything substantive to mention afterward about it. And you do.
Yeah.
I mean, it was actually career building and expanding. And I think for anybody listening, that is the mindset you need to have when going into those medical missions. So, and you took gap years. I know that a lot of people are saying more and more, and I'm obviously an advocate of it with how old I am. I personally think gap years are amazing, and they help with honing your craft and honing your mindset. And during that time, you're prepping, like, okay, I'm going to be going to medical school. So with that, how did you end up choosing the medical school that you ended up attending? I mean, we all know that, I mean, choice is in my opinion, somewhat of an illusion in the whole process, because arguably medical school is the hardest graduate school to get into. But so, I mean, I know that you have a list of schools that you pick out, and like, what was that process for you?
Yeah, no, that's a great question. So I mean, just like anyone else going through this process right now, that at the end of the day, you just kind of apply for as many medical schools as you can. And you do just kind of hope that someone's going to bite. But if you're one of the ones that, you have multiple medical schools that you're looking at, I mean, for me, the big thing was, what is what are the factors in medical school for like what you're wanting to do? So if I knew that, pediatrics was something I was interested in, trauma surgery was something I was interested in. So I wanted a place that kind of had good experience with those. Medical College of Wisconsin is a fantastic program. They have a beautiful children's hospital. It's one of the centers in the Midwest where, you know, they're doing transplants. They're doing heart transplants, you name it. And so with that higher level of care, it's fantastic resources for you to kind of step into. I know the question for, you know, MD versus DO and which way do I go with that? I wanted something with a really robust resources that I could step into. I didn't want something that, you know, you would have to kind of go to different locations to get your rotations. And I wanted something that was like everything is right there. And that's sometimes why those schools are so competitive. But I think, you know, shooting for the moon and sometimes falling to the stars and being happy with that. That's why I was going for Northwestern in Chicago, University of Chicago, and some of those places. And, you know, I had some connections to those places with the research I was doing. But ultimately, Medical College of Wisconsin, you know, we were living close to there at the time. And I will say for some medical schools, that makes a big difference are you a resident in the state that you're applying to? I remember applying to University of Wisconsin in Madison. And the first time I applied, so I actually applied 2 years. The first year I didn't get in. The first year I applied, I wasn't a resident in Wisconsin, and I got denied quickly. So that it was automatically like, well, that's not even an option. But the second year, when I was a resident, you know, I actually started going through the process with them, which was really interesting. So for me, part of it was sometimes you have a choice, sometimes you don't. But I think knowing a basic idea of what I wanted to do, making sure I had resources for that. And then I think it's also good to look into what are the 4 years going to be like for you? What are you wanting to get out of medical school? So those robust resources, that for me was a big deal to have everything in one place. And Medical College of Wisconsin definitely had that. And then outside of that, I think just like the non-medical aspects of, are you going to be able to survive medical school? So what does the area look like there? Do you want to be in a city? Do you want to be close to water? Milwaukee is a dope place, man. It is like Chicago, but everything's within 15 minutes. So for me, it was perfect. My family was like 2.5, 3 hours away. So having social support, I mean, medical school is a rough process, and having people around is a great thing too. So I think that there's medical and non-medical aspects you really need to consider when you're making your choice.
That is wisdom that I think a lot of people who've already been through the process wish that they had heard about or adhered to. So for those of us who are about to step in, I think that's a very important. And this is, I'm going to classify this as question 3B. You said on your second time around, you were a resident of Wisconsin. Did you move there because you fell in love with that medical school and say, like, you know what, if they want residents, I'm going to move to that state? Or was it a happenstance thing?
No, I fell in love with a woman, man, and I got married.
Oh, for me, that's even better. Nice.
No, so she was finishing up, my wife, Katie, she was finishing up nursing school in Waukesha, which is just outside of Milwaukee. So, you know, we kind of made the plan for, like, you know, we'll move to Wisconsin. She'll finish up. I was able to get a job kind of in the Milwaukee area. So for me, getting into Medical College of Wisconsin, that was a big deal. Going through this process, I've definitely learned that sometimes it does help to have connections. The person that I interviewed, you know, it was so funny because she interviewed me, and she said, like, her big thing when she was looking at my resume, she's like, how do you know you want to be a doctor? You really don't have that much shadowing experience. And I was like, well, I've done volunteer work in the hospital. I've done these medical mission trips. But she's like, but why a doctor? Why not a PA? Why not a PT? Like, you name it. There's all these other things. And I was like, honestly, ma'am, because I don't know many doctors. I don't have those connections. And I was like, I would love to shadow you. And I was able to shadow her. And then a couple months later, I got accepted. So I don't know if that, you know, if that like played into it as well. But I think,
That's
you know,
ingenious.
doing what you know, if there's something that, like, And there's so many people out there that's like, I want to go to medical school. I don't know how to do this. I don't know the process. Sometimes it's just being honest and just talking with people and saying like, can you help me get there? Like, I would love to see what you do. I would love to see what this process looks like. So for me, that's what I did. And that was big. But no, me going to Wisconsin was for a woman first and foremost. And then getting into medical school was great after that.
Awesome. So once you were in medical school initially, what was the thing that surprised you the most?
I think it was how fast you realize there's a lot of things you don't know. I mean, we all go into medical school. You get chosen because you're a smart person. Like you're not an idiot, but you go in and then all of a sudden it's like, crap, I don't know anything. And I don't care how much, you've been a medic, you have your PhD, you've done stuff in the medical field before. You get to medical school and it is absolutely a fire hose. I think that is like the thing that immediately everyone goes, oh crap.
What have I done?
What have I done? Exactly. And it's so funny. If you look at the rates for, wellness, if you look at the rates, and the sad thing, like rates for suicide, depression, things like that, usually hits like 6 months to a year in when people realize, holy cow, what have I gotten myself into? But I think like for me, that was a big surprise. I had a great group of friends that, we were all kind of going through the same thing together. But even with the biology and chemistry degrees, I did well in pre-med. I was a straight A. Everyone's got a GPA of like 3.8 to 4.0 to like whatever above that. And you just hit those classes. You just got to know like, it is a fire hose. You're going to feel exhausted. I didn't realize how bad it would be at first. My first test, man, I think I got a 70 in anatomy and something just like, it just hit me like a bag of bricks. And I was like, okay, I gotta buckle down. Yeah. But I think like trying to figure out for myself, especially taking a few years off and then going back into it of how do I do this whole like learning process? It's such a high speed and what it demands of you. That is definitely a shock, but I think that's also a commonality that everyone has going into it.
Well, two things I took from that is one, I'm doomed. And the second thing is at the time that test grade must have been just, but I mean, we fast forward, time goes on, here you are.
Yeah.
It didn't impede you, but there are lessons to be learned. I mean, we could unpack that a lot, but I just hope that people who are listening who might be in medical school right now, or even like you got to see an OCHEM or something like that, it's not the end of the world. There is, I mean, you can still be like Dr. DeJong and move forward and become amazing. And I think that's an objective thing that you're amazing. I mean, it's your story so far has just been incredible. So I'm just stating the obvious, but with all that, you were talking about how that was a surprise for you. Would you say that was the biggest challenge that you faced in medical school, or as things progressed, was there something else that ended up surpassing it?
Yeah, no. So I think there's probably, oh man, I'm going to say there's probably 2 or 3 things, and I'm going to go medical and non-medical again, because I think the reality that we don't really talk about is the impact that how difficult this process is. And it is life-changing in the best way and sometimes the most stressful ways possible. So probably one of the biggest challenges in medical school, I do think that there's a challenge for what am I actually wanting to do? Like I want to dedicate myself to a field, and you do kind of silo yourself in. And, I think a lot of people go, am I making the right decision? So first couple of years, just trying to get through, trying to learn the material. Then the last couple of years of trying to figure out, do I want to do pediatrics? Do I want to do internal medicine, family medicine? What does that look like? I think that's a really big challenge. And, there's definitely going to be nights where people are up and they're trying to figure out like, man, am I choosing the right road? Like, am I going to do well in this field? And I think that's a big challenge for just yourself. And I think realizing that is a common challenge, and the importance of talking through decisions with with mentors, like finding docs where you can just kind of touch base and say, this is what I'm thinking, this is what I want to do with my life, what does that kind of look like? But also knowing that with it being such a big challenge, yeah, I know a lot of people that they started going in one direction and all of a sudden they changed courses. That's why it is a challenge, and you know, it's a big decision that you have to make. So I'd say that was probably one of the big things. The other big thing was trying to balance a personal life in medical school as well, which I think is such an important thing when you're going through these stressful times. Like, I think one of the biggest things you have to figure out is how do I keep my sanity? How do I keep who I am when I really am not doing anything else besides just studying and trying to get through this? So for me, my first child was born 2 days before orientation to medical school. My second child was born. Was it 2 days before my big cardiology final? And you know, the way that our school did it was your grade was 80% your final. I mean, that was your grade for the rotation. And I talked to the course director, and he's like, so you could do it one of either ways. You could still take it on that day, or if you want, you could take it a week early. And if you take it a week early, you're gonna have to go through all the information on your own. So it's a week of all of these presentations that you just gotta smash through the info. And I did it. I passed. I don't even remember, man. It's such a blank, like what I actually got on that. But it's a reality for just when your own personal life meets the difficulty for medical school. And I think knowing that, you know, that's just something you just kind of got to roll with the punches. And how do you keep your sanity with that? For me, it definitely looked like being involved in my communities. I love volleyball, so I did intramural volleyball and getting my workouts in. And how do you do that with still having schedule and whatnot? That's hard to figure out. But I think that's also a big part of medical school, because once you get to residency, it's the same issues, you know? So I think, yeah, those are probably the two big ones, I'd say.
Yeah, it's funny you mentioned that last part. I remember when I first started working in hospital administration, one of the first things that I was tangentially a part of was the tenure track for physicians. Yeah. And I looked through the requirements, and I was thinking, these are like the prereqs for medical schools. Like, how many publications do they have? It's the same, like, it's the cycle just keeps going. But the thing is, like, by that point you're used to it. But yeah, I think having that mindset of it keeps happening is important. But yeah, holy cow, I mean, I can't even imagine. I have kids myself, and just the stress of having to study for those exams.
Oh yeah.
While your loved one is in the hospital recovering, and you have this new child you want to get to know.
Yeah.
Kudos to you. That's amazing grit and determination.
You bring up such a good point too, of, you know, as you're applying for residencies and trying to stay competitive, you're always trying to, you know, what do I need to do to make myself stand out? And I mean, that's a completely different challenge. You know, I have to get publications. Do I have the right resources? Are my letters of recommendation good? Am I building professional relationships to get me there? Can I get to conferences and whatnot? I mean, those are all hard things that you got to figure out. But I think balancing that with your personal life too, so you come out sane on the other side. So yeah, I mean, I think to say that there's just one challenge, man, no, there's multiple.
that is fantastic to know. And you mentioned, like, applying for residency and whatnot. You have to see how many publications are like the standard, the average for an applicant in that specialty and whatnot.
Yeah.
And that is a big, and like you were saying, that's one of the challenges is, where do I fit in? What specialty am I going to go into? This isn't like PA school that you can change your specialty later. You're kind of locked in after X years of residency. So with that and all that decision making, how did you specifically and why did you specifically pick Army Pediatrics? I mean, you said that your some of the people who inspired you were oncologists, and then you went and you were thinking trauma surgery ahead of time. And those two, I mean, the people who inspired you, it didn't even sound like you were considering that, but they inspired you. And so, like, what led to that decision?
Yeah, I'll address the pediatrics and Army kind of separately, because I think going into the military in general, you can do any specialty you want in the military, which I think a lot of people don't understand. In pediatrics, you are not limited by what you can do in the Army. And I can address that later too, but I'll start with pediatrics. So I think for those people that are trying to figure out, I like working with kids. I think it's interesting. I think working with pediatrics, you are working with probably the best population you could. You are working with kids that there's an innocence to what they're going through, but there's also just a sense of the patient in front of you is a blank slate. So I love doing newborn medicine for the sense that I am the first person to ever do a physical exam on this patient. You have no idea if this baby being born is going to go develop type 1 diabetes, if they're going to get some sort of congenital neuromuscular disorder, what's going on. You have no idea. So you are the first one on the ground for this patient trying to figure things out. So your differentials are so much broader. You're not rabbit holed into one thing. So I've really enjoyed doing that. I feel like I have to stay sharp on all of the really random disorders because you just don't know what's going to pop up. You've got your resources in the community to help you out. But for me, I always have enjoyed that aspect. I think as people are trying to figure out what field I want to go into, one way of looking at it that in medical school, a senior student was telling me is like, think of the worst day possible for your field and figure out if I had to deal with that every day for the rest of my life, would I be happy? So for pediatrics, people are like, oh, the well child check is probably, you do that day in and day out. You deal with parents day in and day out. I love doing that. Well child checks. I get to play with like 6-month-olds that really are just super happy kids. You get to be silly with 2-year-olds, 3-year-olds, like playing with them on the floor. But what you're really doing is evaluating their developmental milestones. It's in such like a unique way. I think parents are amazing. I think there's a lot of difficulty with them, but I think if you figure out, that they are just trying to do what's best for their kid and you give them the information, you can step into some really amazing environments. I remember during medical school, I had a number of kids that I experienced in the hospital that had like child abuse or neglect or just these incredible things that's like, man, these kids didn't deserve that. But you get to step in a way and try to just be objective. It's such like an emotionally charged field. And you get to be like a voice of reason, not necessarily to say like, are people good or bad, but to say this is what's going on with your child and we're going to try to help out and support you as much as possible. And then I would also say I've seen I have definitely within pediatrics, I mean, every field you experience the extremes of emotions. I talked about, being really interested in pediatric oncology, and I've actually settled into Gen Peds as what I've wanted to do overall. But seeing kids like fight cancer and just knowing that this kid did nothing to deserve this, and I want to try to help out as much as possible. That's an amazing thing. And then on the flip side, what am I not having to deal with? High blood pressure, cholesterol, diabetes from people that have eaten themselves into an oblivion. I mean, I remember going through like family medicine, internal medicine, being like, that's just not for me. That's just, I don't have to deal with that. You look at my problem list versus the adult side problem list, it's a lot easier. And if there is a big problem list, that kid's complicated and that kid's interesting. So absolutely, pediatrics is the way to go.
No, don't have to deal with an abusive agency. It's a completely different ballgame. That's the best way I've ever had it. The way you described it was the best way I've ever heard it described. That's amazing and eye-opening, to be honest. Thank you. So with the next question, if you had to do all of this all over again, would you still have taken this route?
Absolutely.
And yeah. as well with the Army aspect of it.
Yeah, absolutely. So I'll start with pediatrics and then I'll go to Army. So I think, I don't really have any regrets with what I've done going into pediatrics. It's a fantastic field. I find, in talking with other pediatricians at other bases, other places around the country as well, there's definitely burnout. Don't get me wrong. Pediatrics, it definitely has burnout, but you're dealing with kids. It's a happier environment. I have found personally that I get a lot of enjoyment, but the people that you deal with are just the most amazing people that are trying to help out kids, trying to make this country a better place with the future of our country. I absolutely would choose pediatrics again, time and time over. The Army route, absolutely. I think that was, I'm so glad that I made that choice. So a couple of reasons, just to start off, like just looking at medical school, not having to pay for medical school, not being stuck with $400,000 to $500,000 in debt and trying to figure out the interest afterwards. Absolutely, that's amazing. So just as I'm talking about that, you can't help but not talk about the money aspect. I'm not saying that's the reason why I did it, but that's a big part for some people, and that's something you got to think about. As I'm looking towards my time back, and let's just talk about pay a second. Residencies at civilian programs, what they're making $60,000 to $70,000 a year. The number of hours you're putting in, it comes out to be around minimum wage.
If that.
For pediatric Army residency, you get paid as an officer. So in the residency program, I was a captain. So that means I'm paid as an O3 level. So between what you're making as a captain, and then you get a little bit of incentive pay as you're actually becoming a resident. I mean, it's closer to $180,000. So it's probably $100,000 extra a year, as well as free health coverage, and then all the benefits of being an active duty soldier. So, I mean, I've got the Amex Platinum credit card and the Chase Sapphire credit card, and don't pay the annual fees for it and whatnot for it. I mean, that's like, it's just something to talk about for like, that's a big deal for not having to be in debt and not having to worry about, all the money and stuff that you're paying for to pay off your student loans. So I think having the financial security and to just focus on your training program. The Army does not touch you while you're in your training program. They're not sending you on deployments. They don't want to. You're being trained as a doctor. And then going into the Army afterwards, I mean, just having the expectation of, first and foremost, the Army sees you as a general medical officer. You get assigned to units, but the places I've been able to go to, so Georgia has been an amazing location. I've been attached to a hospital, and what that means is that I work inpatient, so I cover the nursery, I cover the floor, I cover the clinic. If the infantry division that's on base has a need for a doctor, they will reach out to the hospital and they will touch base with me and potentially say like, hey, we might need a doctor to go do entrance physicals in Jacksonville, for instance, for 3 months. So that was something that they asked, like they, said like, this is something you might have to do. You go in open eyes, and that's just, that's something that you might have to do. I ended up not having to do that. But there's another pediatrician that I know that he's a pediatrician, and I won't go through the details. It's pretty complicated, but he's also attached to a unit kind of like on the side. And they deployed to Poland, and he went with the team to Poland, and he was their battalion surgeon, which people don't really think about with the Army and being a pediatrician, but he was taking care of soldiers over there. How do you do that as a pediatrician? Well, soldiers are just giant kids, is what I see. They have the same problems as teenagers. It's the STDs, it's the MSK, it's the mental health problem that we deal with all the time in pediatrics. So absolutely, pediatricians make fantastic Army doctors. But you know that going into it, it's your way of serving back to the country. It's not forever. For some people, it's 4 years. For me, I'm staying in longer because I've really enjoyed my time so far. I get to serve my country. I get to work not only with the pediatric population, but I get to work with our military population, which serves our country, and I get to serve them. I get to make sure that when soldiers are deployed, their families are cared for. I go above and beyond for my patients because I'm not being paid for each patient that I see. I'm being paid a solid rate as an officer. And if I have extra time, you better believe I'm going to do what I need to help out my patients because I know what their families are going through.
That is completely inspirational, so informational too. Honestly, I almost quit the pre-medical pathway because of the the hours and financial compensation for a residency. But
Yeah,
for me and for so many others, it's like, you know what, I'm gonna have to swallow it. I know what I want to do with my life. But it
absolutely.
sounds like the military, the Army, is treating you right, and it is avoiding all of those issues. I mean, I literally joined the American College of Legal Medicine because of this issue with residency,
Yeah,
and all that. And I want to dive into that, but it looks like the thank you for your service. For me, that is just the bare minimum compensation you can get for all what you do for our country.
right.
But I mean, you are being treated amazingly well compared to other residents, and that is amazing. Congratulations for the amazing pathway that you picked.
Yeah. No, absolutely. And it's one of those where you go into it knowing that you're serving your country, and the experiences that you have are incredible. I know people, some people that were in my residency program, they graduated the year before me. One of them left residency program. She did pediatrics at an army base in South Korea for 2 years. And now she's in Germany and she's doing pediatrics in Germany. So she's seeing the world. The army's paying to move her to all these different locations. What you would think of as pediatrics in a civilian clinic is what she's doing in the clinics on these bases in these amazing locations. And so the army gives you this ability to travel the world. They do say, you are owned by the army. If they want you to go and do a deployment or something like that, they will. But they're also treating their doctors really, really well right now. Because to be honest, not many people know about Army pediatrics and don't know. And so right now we actually have a lot of openings for people, medical students, to come into these residency programs. The Army's doubled down on pediatrics in general. And so when I'm trying to think, is it worth still going into pediatrics in the Army? Absolutely. So they just, for instance, they updated their academic calendar, which is basically how many positions are we wanting to put in for all these subspecialty programs, which can kind of be, a proxy for how dedicated is the Army to it. And they have kept the same number of fellowship programs. They've actually increased some of them recently, which to me shows me that the history of Army pediatrics is strong and the Army is wanting to invest into it. So it might, do I think that it's still worth going in? Would I go back into it if I was, back then? Absolutely, I would.
And would you say I mean, it sounds obvious, but I want to make sure. Did it meet your expectations?
Absolutely. No. So I would say there was definitely like there are aspects of it that I really didn't know about. I mean, how can you really know what being a doctor is going to be like until you get into it? I think residency is just this, it's a grind, it is grueling. But being a doctor now, um, yeah, I would actually say to a degree, no. And what I mean by that is I think that there's this expectation that when you become a doctor, you are an expert in your field, which you absolutely are, but you may not always feel that way. The number of times, you talk about oh shoot, what's the phrase that I'm thinking of? The imposter syndrome. There you go. Imposter syndrome is still a thing for physicians as much as it is for residents, as much as it is for medical students. You feel more comfortable as time goes on. I've done the number of times I've dealt with ADHD, autism, mental health problems, and child checks and kids. I feel very comfortable with where I'm at with that. But you still run into issues where you're like, man, I am stumped. And I always thought I would always know the answers as a doctor. But I think just having the expectation and maybe changing the expectation is what I needed to do. Of you will have the skills that you need to do your job well. And I absolutely do. I absolutely 100% believe that. But I always expected I would always have the answers, and that's just not the case. But that's why we have these amazing societies. So you said I'm a fellow of the American Academy of Pediatrics. That means I'm board certified, but it also means I'm a part of a larger community that I can go to if I really need help with administrative issues, with issues with individual patients and whatnot. And so I think that for me was very eye-opening for how much that being a physician also means being really good colleague, peer, and friend to those around you to be successful.
Okay.
But
And
besides that, I love being a doctor. So that
yeah,
aspect,
yeah.
yes, it has met my expectations. Yeah.
So with what you were describing, and especially because you were saying that pediatric patients are a blank slate
Mm.
compared to their adult counterparts, is there a typical day at work? Is that possible to describe that, or is it just so variable? I mean, I don't know. I don't work in pediatrics.
Yeah, that's a great question. So a typical day for me. So I being in the Army in the position that I'm in, my day can look different because I do outpatient and patient. So a typical outpatient day, I usually roll in, um, and I probably see about 20 to 22 patients in a day, usually 20-minute appointments. Our clinic kind of splits it up between virtual appointments, 10-minute appointments for like quick hit things, 30-minute appointments for a little bit longer. Um, and, I have a great support staff with different nurses that they will help to kind of in process patients and gather the information. And I just kind of crank out patients. Lunch very much I have time to eat lunch, but I usually do my notes during lunch. I've figured out how to optimize my time so that I can get all of my notes done and get out of there by I think I usually leave by 4:30. You know, I and for me that a big part of it was just learning how to use your system most
Yeah.
appropriately. Um, so usually, get in around 7 a.m., usually leave about 4:30. If I'm doing
Uh-huh.
outpatient, that's probably Monday through Friday. For me, it's different because since I do inpatient as well and I split my time, I also have 12-hour and 24-hour shifts that I do on the inpatient side of things. So for inpatient, for me, Army Pediatrics, um, I am covering the nursery. So I round on babies in the morning. Usually get in at 6:30 and I do 6:30 to 6:30, so 6:30 a.m. to 6:30 p.m. I round on babies. I do discharges. But during the day, I also cover down for the clinic since our clinic is attached to the hospital. So if there's any
Oh,
walk-ins, if there's urgent things that need to be managed, I step into those things. There's been a number of times we've had asthma exacerbations come to clinic and they just need some additional help. So I will go there. Our ER is also attached to the same hospital. So I'll be on call for the ER if they have questions, if they had missions. So it's kind of a hodgepodge, a lot of different things. But I will tell you that as an Army pediatrician, kind of covering the whole gambit, there are times that I am jumping between walk-in appointments that I've done on an outpatient setting, seeing completely newborn babies, and then going to resuscitations for babies that are born that are not breathing, that are blue and floppy and really struggling to stay alive, and just trying to manage them until we can, stabilize them and potentially transfer them out, or, just give them what they need at our facility. So my days, they're kind of a hodgepodge of a lot of different things. And
yeah.
I love it. It is great. It keeps me on my toes. I will say I am not bored. Um, in Army pediatrics, they push leadership opportunities all the time. So I also help to oversee PA students that rotate through our
Okay.
clinic and NP students. So I do a lot of precepting and teaching with them. I try to help out with NRP, which is basically, if you think of like BLS, but for babies.
Oh,
I try to help out with that, do some teaching with the nurses and whatnot. So I kind of do a lot of hodgepodge things of a lot of different, but those are typical days for me, is a lot of different type of variety of pediatric things. Um, Sometimes I'm siloed into just outpatient. Sometimes it's a little bit of a lot. Yeah.
yeah. That sounds amazing. And you also get to teach and
Yeah.
have that as a part of your workflow. I remember you mentioned that your two gap years were research oriented. So you currently have
Yes.
teaching involved in your workflow. Do you still have any research involved in what you do with your career? And if so, both of the research and or the teaching, Do you like the amount that you're able to do? Would you like more, less? How's that working?
So research and teaching kind of separately. So research, I have a passion for research. I chose to not further pursue research in my career. Main reason being I wanted to be all in on one thing or another. So you hear of clinician scientists that they will do 30% of their time in their clinic, 70% of the time doing research. And the ones that I talked to, they really brought up how competitive it is to apply for the same grants to fund their research when they're only spending 70% of their time doing that, and other people are spending 100% of their time doing research. That is a reality. That is a really hard thing that we have not been able to figure out. That means you're either spending more time on your days off, writing papers or doing additional research, or you're just doing your best. So I decided that if I was going to be a clinician, if I wanted to be in pediatrics, I was going to be all in for that. So that was the main reason why I decided I don't think I'm going to further pursue research. I'm so grateful for that time that I did, because it's given me such a better understanding of the literature that's out there, of the basic science for how do we get to those points, but also just molecular cellular biology in general, which I will nerd out and say that I love that stuff. I think it's great. Towards academics, I've moved more and more into academics. So my year as a chief resident, I really was able to step into a teaching position more, which I enjoyed helping out. As a medical student, I loved, there are a few teachers that I had that I really looked up to and said, man, I love what you're doing. I love the amount of time you're able to dedicate to just teaching others. In residency, I kind of developed a love for that as well. And so that's why I ended up pursuing a chief residency year. For those of you that don't know, in pediatrics, that's an additional year. So you're not still in your residency program. You're done with residency and you have to apply to get that chief residency position. So of our program of 24 residents, I was the only chief resident, and it meant that I had an opportunity to do a lot more teaching. So now as a general pediatrician, being able to have some teaching opportunities with the students, I feel that right now I have a lot of freedom for how much I dedicate to that, just because of how things are set up for me right now. Within Army, I'm looking to potentially become an assistant program director and then program director down the road. So usually 3 to 5 years of being in the clinic and just doing general pediatric medicine and then stepping into that. So that's kind of what my 5-year plan looks like. And I'm continuing to want to go into that. So am I doing as much teaching as I want right now? No, but that's just because of where I'm at in my career. Yeah. I'm 2 years in and ebbs and flows. And that's just how it goes. So I think knowing what your passion is. So teaching's my passion. I get to do some of that. I take advantage. And you just ask around for how can you do more of that. And then that kind of pushes you into what you want to do in the future. Army is great for if you want to be in academics in the Army. There are absolutely amazing opportunities to do that. Army actually has a really great fellowship program that's called Faculty Development and Leadership Fellowship, which as you go through it, it's a 3-year fellowship. You get an MBA on the Army's dime. And with that, they basically teach you all that you need to know about, if you're wanting to go into academics, administration, or a different type of leadership position, they prep you for that sort of career, which is fantastic. So the Army already has things for me in the future that I could kind of go into for going into a program director position. So those are things that I'm not doing as much as I want, but those are absolutely on my horizons, and I'm building up to that.
That's amazing. And once again, it shows it's a perfect combination of your grit, your determination, your abilities, while also being able to be in an ecosystem that the Army is giving you that wants you to thrive. And that's just, that's so amazing. So with that position that you are in right now and knowing all that you know now, what would you have said to yourself 10 years ago if you had that, interstellar moment. You're on the other side of the bookshelf. For some reason, you could communicate with yourself 10 years ago. What would you say to that version of yourself?
I love that. Yeah, the big thing I would say is, just always be kind of thinking of the future for what you're wanting. So what you're passionate for, what you're wanting to do in the future, always keeping that in the front of your mind. I feel like 10 years ago, for me, I was in college, first couple of years of college, and I was like, I don't really like these classes, these history classes, these other ones. And I kind of goofed off in some of them. But, first off, like, that doesn't help you as you're applying for medical school. Medical schools want to see you be like as successful as possible. And they want the people that are as successful as possible. So they look back to say, have you been successful? So you need to prove to them that you're going to pay attention and get done what you need to. So I think, having a forward mindset is so important. And people think, like, even in high school years, like, oh, it's just high school, it doesn't matter. High school sets you up for college. College sets you up for medical school. And so if you really want to be successful in a really competitive field, you need to buckle down and do what you need to do. So I think that's one thing that I would probably say to myself, but also just, focus on and being the best person that you can be. I think a lot of the soft skills that we talk about as doctors that are so important. You go to medical school, you go to residency, they're going to teach you all the information that you need to know. So being a good learner is so important, but you also need to have all the soft skills for how do I talk to people? How do I have a good world perspective so I can be understanding of my patients that are coming into me with various issues? And I may not know your background, but how can I still be respectful of that and be a good clinician? And I think that comes from personal experience. So, for some people that means traveling, seeing the world. For other people, it just means having really robust experiences, working with different populations that you wouldn't otherwise do. I don't think I put a lot of emphasis on that earlier on. I went through high school. I had a great time with, where I was at. College, I had a great time, as you should. But I think trying to broaden your horizons, trying to have those different opportunities. We talked about those gap years and how really that's a great time for people. Some people travel, some people like go into a different field. Some people start to look at the medical field, but they start to interact with different groups, try to figure out what do I want to do with my life. I think is so important. But I think just having those different soft skills that you're developing by putting yourself in different situations is really important. So I'd say that's one thing. And the other thing is even early on in your career, try to find people at the next step and start asking them questions about what does this actually look like. The undergraduate program that I was in, very small pre-med program. And I don't feel I utilized the resources that we even had there enough. I wasn't trying to like talk with doctors and saying like, hey, can I just have lunch with you? Can I have coffee with you? And just pick your brain on what this looks like? What do I need to be doing? I was just, I was a little naive and thought, I'm just going to go through this process and try to figure it out. That's why I didn't get in the first year. It's not just because I didn't have the skill set. It's because I didn't know what I needed to know. I didn't know what the process was like. And you're not going to know that unless you start talking to people. So building up your own skills for how do I interact with people around me? How do I have the humility to say, I don't know what this process looks like. I'm not going to get there on my own. I need to have a community of people around me to help me do that. And I wish I would have had more of that awareness 10 years ago.
Yeah, I think that people who become islands into themselves, they don't reaching out to other people, it's hard. You need a community to
Yeah.
build you, and those are extremely wise words. And you were talking about how those skills are important, and cultivating those skills. And it seems like your mindset has changed over time. Does that affect at all what you do in the free time that you do have? I mean, how do you spend that free time? Do you have hobbies that you do? I mean, I know you have a family, and how
Mm-hmm.
do you feel like there's a healthy balance that you have with all that?
Yeah, no, absolutely. I think as you go on, you realize the importance of having those hobbies. So I'm a foodie. I love food. I love
Oh,
traveling. Yeah. No, I'm all about the different types of food, man. So actually, the reason why we're doing this interview now and not next week is because I'm actually going to Croatia with my wife. We're celebrating 10 years. So yeah, super exciting.
congratulations.
Thank you. Woo, woo, woo. But I have found the importance of, like, for me, it's always having what's the next big fun trip that we're going to do. And that's always like this might be hard now, but I know, like, give it a couple months. Like I got the super cool thing that we're gonna go do. So that is a big hobby for me is planning and looking at fun things to do. Even just like fun weekend trips. Like I've got a fun weekend trip to Philadelphia coming up in a couple of months. There's great places around here where we just like pick out little fun things to do. So for me, traveling is a big thing. I play drums. So I've played drums for 18 years now. So the church that I go to, I play drums at. That is something that I love to do. In this past year, I actually got my own drum set. So now it's here. I can do drumming at my house. I can kind of jam out, but I've also got like an outlet for drumming at church too. I think having your outlets is really good. I also play volleyball. So once or twice a month, I'll go play volleyball at like a local, just like little place, just kind of like, shoot the breeze and whatnot. So
Yeah.
those are kind of my big things for, you have your hobbies, you develop them younger. Sometimes you develop more hobbies as time goes on. Those are things that I've always loved to do. And to be honest, like I kind of sucked in medical school at doing those things. And it wasn't until like, almost the end of medical school, I really started stepping back into like intramural volleyball, stepping back into playing drums. And it's like, oh, hey, I actually feel better about myself. Like my wellness is way better as I start to like get back to my hobbies. But I think sometimes you get to a point of just being exhausted. It's like, I don't have any time, but you just got to make time for some of those things. So I think that was a big thing for me. Another big thing was realizing the importance of just like good exercise, good eating, even when sometimes you don't want to. I think for me, that is so important, is just taking care of yourself, taking care of your body. So you can be like at the top of your game, sure. But, for me, running, I used to hate running. And then I just did it more and more. I ran a half marathon. And all of a sudden I was like, actually, this is a great way to relieve stress. And, the data out there for just doing repetitive motions such as running, biking, things like that, for just like a natural stress relief is fantastic. So I think for me, it was finding what that was. And so for a 20-30 minute run, in my perspectives just changed, and it just having
Oh, yeah.
that for you, I think that was huge. So definitely exercise, traveling, volleyball, all that good stuff. Yeah, man. No, I think I've gotten better at what I do with my free time as time has gone on.
That is so awesome. And, even though I'm a fitness enthusiast, exercise science was my undergraduate, and I've done athletics and sports all throughout since high school and beyond. One of my favorite quotes, you were talking about running, is from Parks and Rec. It's Ann Perkins. And she says, I'm a healthcare provider. I know it's important, but running, at what cost? And I just think, yeah,
Yes.
but I do starting to run. It's a hard thing to start, but once you get into it, it's a game changer in my opinion. Yeah.
Yeah.
Um, Mentioning game changing things, from your perspective, what is the biggest problem in healthcare today, and is there a way to game change that?
Ooh. Yeah. No, that's a great question. I personally think we have a system that's set up right now where I mean it's hard to pick one, but I think the top two I would say is one would be just burnouts and just are no longer as physicians, the number of physicians that I've seen where they don't have this drive, the drive to just be interested, the curiosity about what's going on with patients, and it becomes more of just like a mundane day-to-day thing, versus when you're in medical school, you can think about, you see that interesting case and you're like, oh, this is so interesting. I want to know more. I want to dive into this more. I think that as time goes on and people have burnout, that just goes away. And it's a perspective changer. If you think about it like logically and what's the word I'm trying to, yeah, I think that's fine. But the impact that it has on people's productivity, the connections that they develop with patients, and then the ability to deliver good patient care, burnout has just changed so many aspects of the way that we deliver care. And then I would say the second thing is there's such a focus on healthcare costs and trying to make things as productive as possible. I've seen clinics where they've gone from 30-minute appointments to 20-minute appointments, 15-minute appointments, where it's like you really don't have much time to build the relationships, to build trust with patients anymore. And that's such a problem when, in this day and age, we're trying to figure out, like, can patients trust us as doctors? And I see that all the time for patients that I don't know. And, we start to have conversations about things like vaccines, and the vaccine hesitancy, vaccine refusal is through the roof. And some people, if I know that this is just an example, if they're not interested in giving their kids vaccines, and some people, they just don't even want to have a conversation with me. They don't know me. They don't know if they can trust me as a doctor. And I think that's so hard. How am I going to start having a conversation with them? How are they going to trust me as a professional if they don't think that they can trust doctors in general? And not having that relationship, not having that additional time to be able to put into that. The difference between those patients and the ones that, I would say is like vaccine hesitant, I've seen them time and time again. And we can at least start to have a conversation where I can say, just tell me like what your thoughts are on this, and what are you concerned about with vaccines? And for them to be able to trust me and to open up to have that conversation. That's so hard to do when our focus is on activity and making costs as low as possible. I think it's a really important thing for us to focus on, but how do we do both? I mean, I know AAP is really trying to focus on that issue a lot with rebuilding trust between doctors and patients. But I think as we focus on that, you take away the basics for being a doctor, and, we want to do no harm. We want to do best by our patients, but we need to be able to have relationships with them. And those soft skills that I kind of was talking about, that's so important. You're not going to be able to be a good clinician if you can't have a relationship with them, and the patients aren't going to listen to what you're wanting to do. So for me, that's probably the biggest issue that I've seen is that. And then you put that, and I think that they're very easily related. The burnout where doctors then, almost as a response to that or leading to that, they're not as interested then to like build the relationships because they're just so tired. They're so stressed. They have to get through their appointments. I only have 5 more minutes with this patient. We just got to crank through some other stuff and move on with my day. And that mindset is so, you miss out on so many other things that could be going on with patients. So I personally think those are probably the two things that, I would say we need to address first and foremost.
And yeah, I think that is so important because there's research that shows that the demeanor and what is going on with the physician does have a direct correlation to patient health outcomes when you wouldn't normally intuitively think that. But what's going on with it? So and another thing I think specifically with you is you're genuine. I think that your enthusiasm and your love and your care for people, it shows, obviously. And so but then knowing that your time is limited and it's cutting into the rapport that you want to build with your patients, they have that limited time with you, and so they don't get to fully, they're getting clouded with all their worries and whatnot of the medical care system. They're on with you for 10-15 minutes, and they don't get to see that genuineness. I think that's just such a wise thing to end us off on, to show how important that is to have that genuineness, and to keep pushing and thrive despite that real burnout situation that we're facing. But with that, once again, I want to thank you for your service. I want to thank you for everything that you do for your patients and for your time. I mean, you're a very busy person. You took time out to help pre-meds like me and also normal pre-meds who are striving and trying to forge a way to make a difference like you already are and will continue to do for decades to come. So thank you for your inspiration and your time. Thank you.
Yeah, absolutely. Thanks for the opportunity.